got into these open wounds. So not only did his work save many, many lives, it also proved that germs did exist, as there was still lingering doubt. And his methods, I believe, really would encourage people to go into hospitals when they needed medical care. Prior to Lister and his findings being implemented, actually a lot of surgeries were performed at home and in different locations because people were afraid of going to the hospital to catch gangrene and to catch the bacteria that were in hospital wards that people were exposed to when they were getting surgeries. So now medicine could really be practiced in hospitals safely. Lister first experimented with carbolic acid. The canister was used to spray the air before surgery. Is the canister that's in the corner of the PowerPoint. And he found that actually just dressing the wound and cleaning the tools in the area with the carbolic acid was more effective than spraying it in the air. Nightingale pioneered tremendous advances in the field of medicine and in the field of nursing. In this letter, Florence Nightingale outlines her belief that patient health depends on the environmental conditions in which they recover from injuries and diseases. She noticed that more soldiers in her care were dying from infectious diseases than were dying from wounds. She thought this was due to overcrowding and malnutrition, but her proposed solutions, better ventilation, better sanitation, were effectively the foundation of modern nursing. A talented mathematician, Nightingale spent the late 1850s proving statistically that a concentration on sanitation cleanliness in hospitals had a hugely beneficial effect on patient recovery rates. International Nurses' Day is celebrated every year on Nightingale's birthday, May 12th. The Nightingale assisted in the nursing effort during the Crimean War. She also founded her own nursing school, the Nightingale Training School, in 1860 at St. Thomas's Hospital. So the appalling statistics she collected during the Crimean War really went on to elicit change, as we'll see in the next slide. An example of one of her pie charts, the legend reads, "The areas of blue, red, and black wedges are each measured from the center as the common vertex. The blue wedges measured from the center of the circle represent area for the deaths from preventable or mitigatable zymotic diseases. The red wedges measured from the center the deaths from wounds. The black wedges measured from the center the deaths from all other causes. The black line across the red triangle in November 1854 marks the boundary of the deaths from all other causes during the month." So it goes on to describe the chart a little bit more. So as we can see, most of the area is taken up by the blue wedges, which really represents the amount of deaths that were caused by infection and preventable diseases. So showing the deaths this way was a really novel approach and really changed a lot of people's minds. I think that her statistics and her way of presenting the information really played a role in how successful she was as an advocate. I think it's fascinating and worth mentioning that Florence Nightingale was actually a strong believer in the miasma theory, much like Chadwick, and her motivation for cleaning bed sheets, bedpans, for using clean wound dressings had to do with the fact that she thought the disease was carried through the smell. So although she took all these precautions and they ended up saving lives, she was actually doing them for the wrong reasons, so to speak. But again, her methods and the demonstrated success of her methods would change public health forever. The last advancement I want to discuss is a smallpox vaccination, which was made compulsory in England and Wales in 1853, which was a huge stride forward for public health. The smallpox vaccination was actually created in 1796, and it took a while to gain public approval. And interestingly enough, the vaccine was made from cowpox and not smallpox itself, when Edward Jenner was noticing that the milkmaids who were milking the cows and getting sores on their hands, they were getting cowpox, had a natural immunity to smallpox. So this is a poster announcing the vaccine to the parish of Liverpool. So when Edward Jenner created the vaccine, he didn't understand on a molecular level why the vaccine was actually really working. And interestingly enough, when the vaccine was made compulsory in 1853, and it was really helping reduce the transmission of smallpox, things like the vaccine, things like better sanitation, they all went and worked together to affirm these scientific findings, to affirm these theories, to affirm these ideas that germs exist in the universe, they infect us, there's disease outbreaks. So the success of all of Lister's methods, Nightingale's methods, the vaccination really came to inform the public and inform Parliament and inform everyone that these things were successful because germs and microbes did exist, which went to advance the field of public health much further. Just to summarize, new science and an increased awareness of the relationship between urban infrastructure and public health inspired a novel push for better legislation and reform, ensuring the Victorian age would lay the framework for the modern field of public health. Thank you so much for watching this presentation, and the next couple slides will be my works cited. They're all hyperlinked, so if any of you care to see these sources, you can ask for a copy of my PowerPoint. I'd be happy to send you the slides, and you can click on the different links. There's some really interesting articles and things that I discovered when forming this presentation. Thank you so much again for watching.